Hi, my name is Kate Miller, and I am one of the 2020 Rural Scholars. I had the opportunity to live in Tipton, Oklahoma this summer and work on a project under Dr. Brian Whitaker, Dr. Mark Woodring, and Laura Brooks, studying the perspectives of Harmon and Tillman County residents on rural healthcare. This is a sort of response to the increasing rates of rural hospital closures across America, but specifically in Oklahoma. And the purpose of this study was really to learn about the strengths and weaknesses of the current healthcare systems in these communities at varying degrees of access, and learn a little bit about the potential future barriers and opportunities as well. I conducted 35 interviews this summer, initially going for educators and government officials, healthcare professionals that would have interaction with large groups of people and really know what they needed. And then use the snowball method, asking those participants who else in the community would have a unique perspective or be willing to share their perspective. And we interviewed them as well. And it would be impossible to move past this slide without acknowledging the big part of this project of us living in Tipton and experiencing all of the rural life in these areas, and what we gained from all of our conversations outside of these structured interview times. Some notable results from this study include how people use healthcare in their community. Most answered that they took their kids, but didn't go on their annual health and wellness checkups, which many also recognized as a potential revenue issue for providers in their community. There was also a big difference in the understanding of what services and providers were available in these communities, both pre and post hospital closure in Tillman County and at different stages of hospital ownership in Harmon County. People also mentioned as barriers to receiving care, money, time, and transportation. I heard these over and over and over again. People dealing with different levels of insurance and without having hospital access in their community, having to travel, take off work, and potentially have to decide whether to call an ambulance or transport themselves, and if that transportation is even available to them. We also spoke about telemedicine as an alternative delivery system for healthcare, and the overwhelming response was that it's good for some things but can't replace face-to-face interaction with a primary care physician. Most people recognized it as a good connection to specialists, especially those that don't require physical examination like mental health care professionals. But some did voice concerns that people using telemedicine to visit doctors in larger hospitals would take resources away from local practitioners. We did have conversations about how the COVID-19 pandemic affected people's views on telemedicine, and it wasn't a big change because if people were comfortable with the technology beforehand, they probably were during the pandemic. But this was also in June and July when it felt like the middle, but now we know it was probably closer to just the beginning of the COVID-19 pandemic in rural areas. So to wrap up, a conclusion of this study is just using these findings to help policymakers, local governments, and community members find the common priorities that create a clear common goal for the right healthcare system for rural communities, which is going to be different everywhere. And to that point, future studies should be completed having these same kinds of conversations, because though we talk about rural life sometimes in big general terms, we also all absolutely recognize that it is broad and varied in a million different ways. So repeating this and having these conversations anywhere that rural healthcare exists is very important. just to take a moment to say a few thank yous. This absolutely would not have been possible without the extension folks in these areas. To Erin, Denise, and Rhonda, thank you so much. To all of the people in both of these communities that were so generous and let us live in your areas and fed us and entertained us and made sure that we were able to learn as much as possible in these 10 weeks. Thank you so much. And a specific thank you to my community liaison, Ginger Creech, and I could not have been more thankful for this opportunity. I left my email there at the bottom of the screen, and I think the contacts of all of our team are on the app and other areas. So I think we're going to head into questions now, but I will absolutely talk about this with anyone, anytime. So thank you so much.